Hello. Hi. Welcome guys. You can see about 3 of them there. Hello, Hema Pallavi. Alrighty. It's 8 o'clock and 3:30 p.m. up in India. Welcome to the Wholesome Wednesday, session number 3. Hello guys. Hello. Alright. Today it is a talk on health, which is very important, and I have got a very prominent and eminent person from the community here, which I will be introducing in a couple of minutes. Before going ahead, just let me tell you about the sari, what I'm draping today. Today I have draped a pure KSIC sari, which is, I'll just get up in a minute, which is a checkered sari. And this is what it is. I'm just turning around just to show you all the KSIC sari. And I have put in a lot of information in my post as well, and I'll be posting that tonight. And as mentioned, there were a few of them who were asking about the KSIC sari. Yes, this is from Mysore. In 1912, Krishna Raja Nalvadi Vodayar was the one who established the Mysore silk factory, and down the lane, after about a few decades, KSIC Incorporation Limited, they were the ones who bought it, and it is run under their name. And all the KSIC saris, I'm not sure whether you guys can see this, it comes with a tag, which is a number tag, and very recent ones comes with this hologram in here. So this is how you distinguish a Mysore silk sari. And the ordinary saris doesn't have this. So if you take this sari to any KSIC factory showroom, they would tell you the year it was weaved and where it has come from, whether it's local or in the sense like whether from the factory or from Chandpatna, that's where the weaving looms are for KSIC. So they will tell you where it has come from. So this is what it is. All right, so now coming to the healthy talk today, coincidentally, today also happens to be Happy Doctor's Day, which I'm very privileged to have Dr. Rekha Rao with me to kind of like, pay our respects and gratitude to what all the doctors do in the community especially in the COVID times. We have seen the doctors gone out of their way and they have rendered their service. And this is an opportunity for us to thank all of them, the doctors in the group, and the person who is sitting right next to me.
Hello,
this is Dr. Rekha Rao. And to pay our respects. And she's wearing a beautiful jacquard sari, which is a pure silk sari, which has got jacquard prints in it, and the weaving is jacquard weaving. And it's a beautiful pink and beige. And she's going to get up now and show her the sari. Considering this is the sari gallery, that's very pretty. Yay. All right, so we have done the tribute for the doctors, being the Happy Doctors Day. And Doctors Day is celebrated at different times in different countries of the world. I think India is celebrating today, but in Australia, I think it is celebrated in October. But anyway, I do have a lot of Indian fans there. And in case if there are any doctors in the group, hats off to them. All right. Okay, let me introduce Dr. Rekha Rao. Dr. Rekha Rao graduated from Bangalore Medical College in 1980, and she spent 5 years working there as a resident medical officer in the local hospital there. And they relocated to Australia in 1985. And after coming here, usually like all doctors find it very difficult to find a job and everything. So they have to start from the scratch. She ended up working in the Sutherland Shire Hospital. And in 1991, she decided to get into the specialist program, which is the RACGP, which is called the Royal Australian College for General Practitioners. And she graduated, she got her fellowship from RACGP in 1991, and she's been practicing as a GP since 1991. And she's very, very well known in the community, as well as in our local Indian community, as well as in other communities like Greek and Italian. And her interests, oh my God, she's got a range of interests. She is interested in so many fields. To start from, it is antenatal care, aged care, cardiology, chronic disease management, infectious diseases, pediatrics, what else? Reproductive medicine, sexual health, and respiratory medicine. And she also has special interest in mental health and also special interest in surgery and occupational health, which is kind of like unusual to see that in India. Occupational health, maybe now it's picking up, but it's very common here. And she is a very, very busy person. And she says that her hobby is traveling, dancing, reading, and yoga. Well, I can definitely say, yes, with little bit of time here and there, she will definitely manage to fulfill her hobbies as well as passion. She is a very, very busy doctor, as busy as a bumblebee. And here you go. I will be passing on to Rekha to tell about breast cancer, which everyone knows it affects so many women in general, and about 2.1 million people, 1 million women are affected, and it's really affecting everyone. So I thought it's just a general topic, and she's able to pass on the information as to the pros and cons and the myths and the facts about breast cancer. So I will leave the floor to her and she will explain it to you all. Thank you, Rekha.
Thank you, Hema. And she's one of my partners in dancing and traveling and everything. So, hello everyone. The reason why I chose the topic of breast cancer is yesterday was Pink Ribbon Day, which is a recognition of breast cancer victims, prevention of breast cancer, research and development of breast cancer. And that's the reason why Hema was wearing a pink sari and I'm wearing a pink sari. That's to respect all the people who have gone through breast cancer, who have survived, and hats off to them. Keep going. First of all, let's talk about normal breast, because once we know what a normal breast is, we can understand what breast cancer is. Now, the normal breast is made up of little ducts, and then you have little lobules called cells, and then this is embedded in fat and connective tissue. And to look after all that, you have nerves, you have blood vessels. And the reason why I'm explaining all this is the cancer can come in any of these places, and the management and the diagnosis and what happens is different in each of the places. So what is breast cancer? What happens is, we all know what cancer is by now, and if any of the cells in the breast have a genetic mutation and the cells start multiplying in an abnormal way and form a lump, these cells can cause the first and early sign of breast cancer. When it is local, we call it carcinoma in situ. When it spreads, then we call it invasive breast cancer. So it can happen to anyone. Now, what are the signs and symptoms of breast cancer? Now, let me give you a disclaimer before I tell anything further. I am actually giving a general talk, and it may be individually different for different people. And I would request each and every one of you to actually consult your own doctors when it comes to your own health and when it comes to any breast issues or anything. This is just a general awareness and promotion of recognizing, treating, and managing breast cancer in the community. Now, what are the symptoms of breast cancer? We can talk. A lot of times we may not have any symptoms at all. It's picked incidentally. When somebody goes for a mammogram, they get a phone call saying something is not right, and they call back, and then bingo, they found that there is a little cancer there, and then it's a little big shock to the system. So that is a big percentage of people. But then there are some people who can come with breast pain. Not all breast pain is breast cancer too. So please remember. So these are varied symptoms. So you can come with breast pain. You can come with a lump, any lump in the breast. It could be breast cancer. It may be something else. So please look into it. Please go and see your doctor. Next thing is skin changes in the breast. The skin may be red. You can have some tethering, puckering. You can have a little bit of swelling, little pitting, like as if there's some fluid there. Any of the skin changes, please consult the doctor and make sure it is not breast cancer. The next important thing is the nipple. Any changes in the nipple, any change. If the nipple which was normal gets inverted, if you have any pigmentation, coloration, any discharge in the nipple, other than milk, nipple should not have any other discharge, bloody discharge, any of these things, we need to consult the doctor. Any lump under the armpit, any lump on top of the neck, anything which is not normal, which is different, the shape of the breast becomes different, any of these things, I would please consult the doctor. Now I'm going to talk generally about breast cancer, what types of breast cancer you have. Now, as I've explained to you, the breast is made up of little ducts, little lobules, connective tissue, blood vessels. So if this cancer comes in the breast duct, we call it intraductal carcinoma. If it is local, we call it carcinoma in situ. If it is spreading, we call it invasive ductal carcinoma. If the breast cancer comes in the lobules is where the milk glands are, where milk is produced. We call it intralobular breast cancer. If it's local, we call it in situ. If it spreads, we call it invasive breast cancer. These are the two most common breast cancers. Then we have other breast cancers where if it's in the connective tissue, we call it phyllodes breast cancer, which is quite an aggressive cancer. And it comes in the connective tissue. If it's in the blood vessels, we call it angiosarcoma. If it is in the nipple, we call it Paget's disease of the nipple. That's another type of breast cancer. Then we have triple negative breast cancer, where all the hormone cells, there are estrogen receptors, progesterone, they're all negative, and this is a very aggressive cancer. Then you can have an inflammatory breast cancer, which is mostly seen when you're breastfeeding, and this is also a very dangerous cancer. The breast looks very inflamed, red, swollen, angry. So these are the different types of breast cancer. What are the stages? I'm not going to go into main details of the stages, but we are going to talk about whether it's local or whether it is invasive. So these are two important things. If it's local, that means we're picked up early, and so there is better outcomes. Then there is stage 1, 1A, 1B. So 2A, then 3, 4. So all this is based on the size of the tumor, and then how big the tumor is, and whether it's local, whether the lymph nodes are involved, whether the axillary lymph nodes are involved. There are some lymph nodes in the chest, whether if that is involved, and if the lymph nodes are under the knee and the neck, if they are involved. So all this will tell us stage A, stage B, 1, 2, 3, 4. When it goes to different parts of the body, like the liver, the lung, or the blood, or the bone, we call it stage 4. So all this is very important to stage, because this will involve in the treatment of the breast cancer. How do we diagnose breast cancer? So to diagnose breast cancer, we don't have that many resources yet, and they're still doing a lot of research. Mammogram is the only screening test we have for breast cancer at this stage, but it's only 85% accurate. So even if the mammogram says it's normal and you find something abnormal, it only means that you should go back, see your doctor, and make sure that nothing else is there. So once the mammogram is a screening test, and in Australia we do it every 2 years after the age of 40, but you can do it earlier, but it's not that accurate. After 40 it's much better. In America and other countries, some other countries in Europe, they actually do it every year from the age of 45 to 55, because it's more common, because the breast is more dense between the age of 45 to 55. And if you miss the first year, you may pick it up the next year. So that's one screening test. Then we have breast ultrasound. So if there is something not right in the mammogram, or if you've got breast implants, or if you're under the age of 40, ultrasound is a better test than mammogram. And sometimes you need to do both to get better diagnosis and better understanding of breast cancer so that we know how to proceed and what to do. Once we have come to this, then we have biopsies. So you can have incision biopsy, or we can have fine needle aspiration biopsy, and they're all more fine tuning, and it's up to what the problem is, and the doctor can decide what is required. Today there are more other tests we can do, like MRI of the breast. It's expensive but very good, more accurate, and it's better, especially at the age of 45 to 52, where the breasts are very dense and mammogram can miss lumps. MRI is much better. There is a new CT being developed in America. Hopefully it will come to Australia, which is very little radiation, and it's very quick, and it picks up breast cancer much earlier than the mammogram and ultrasound. So let's hope it comes to Australia, India, and other parts of the world. It is just there in America now. I think it is there in England too. So these are the things we need to talk about. So this is how we diagnose it. What is the treatment? The three main frames of treatment is radiation, chemotherapy, surgery. So there are different ways of doing it. Sometimes if you find a breast lump and if it's a little big, we actually do chemotherapy first to make the lump smaller, and then we do surgery, and after surgery radiation is there. Most of the times they all go hand in hand, and many of the people might need all three of them in different combinations and different permutations and combination. So the chemotherapy can be based on different receptor cells. It could be depending on what type of breast cancer it is, and it could be hormonal therapy. If the biopsy shows that there are estrogen and progesterone receptors, then we put them on medications which block the estrogen and progesterones. And then there is another medication called Herceptin when you have got HAR receptors and we want to block that because that's another cancer producing receptor. Then we put them on medications like that called Herceptin. Radiotherapy will go hand in hand with all these treatments, and it's all fine-tuned and individually made for each and every patient. So because it's a general talk, I'm going to keep it really gentle. How common is breast cancer? Breast cancer is one of the most common causes of death in women, and they say about 268,600 people in the last year have been diagnosed with breast cancer in the world, and in that 41,000 people have died of breast cancer. In 1975, the survival rate of breast cancer, when we talk about survival rate, we talk about 5 years of survival. And in 1975, the survival rate was about 75%. But today, with all the research and development and the new diagnosis and the new treatment, the survival rate is 99%. Hopefully, it's going to become 100% very shortly. So, what are the risk factors for breast cancer? What are the risk factors? The most common risk factor being a woman. That itself is enough. Age as we get older, especially between the ages of 45 and 55, it's very, very common to have that. Lifestyle. What lifestyle factors are important in contributing to breast cancer? Drinking excess alcohol, smoking, obesity, not eating enough fruit and vegetable. It not only causes breast cancer, but it can cause any cancer. So it's very important and paramount that we all start looking at these factors, which is in our hands, that we can actually look into and prevent it. Gender, being a woman itself, is a big risk of breast cancer. Genes. There are many smaller genes, but the most important genes which we can test now is BRCA1 and BRCA2. And if you do carry the gene, the risk of breast cancer is much higher than with people who don't have the gene. Early menstruation. If you start your menstruation before the age of 12, there is a higher risk of breast cancer. If you have late menopause, if your menopause is over the age of 55, then they say the risk of breast cancer gets higher and higher. Giving birth after the age of 35 is a higher risk of breast cancer. going on HRT for over 5 years. And there's a bit of controversy about oral contraceptive pill. They say it can cause, but the advantages outweigh the disadvantages. So I would just leave it with a big query. If there is a genetic factor, if there's a family history of breast cancer, or you have a gene, think twice before you go on HRT or oral contraceptives. Otherwise, you have to weigh the benefits and risks and again individually decide what suits you. Inherited risk. If somebody in your first degree relative, like your mother, grandmother, cousin, aunt, sister, have had breast cancer, the risk of getting breast cancer gets higher and higher. If you have already had breast cancer before, then the risk of breast cancer gets higher. So when we talk about all these things, we know that there are so many other variables, but what is in our hand is lifestyle change, and that's what we should look into. I would end with one of the most important things is that let's spread the awareness of breast cancer among all our family and friends. And let me go with a positive note that they are trying to develop a vaccine for breast cancer. And this vaccine is, after you've been diagnosed with breast cancer, this vaccine might prevent you from getting a breast cancer again. Like I said, one of the risks of getting breast cancer, if you've already had breast cancer, the risk of getting breast cancer in the other breast is also high. Prophylactic treatment is another thing I would like to talk about. Like if you have genetic risks of getting breast cancer, then there are things like, there are people who might even do mastectomy as prophylaxis. They might remove the ovaries, and they can go on hormone receptor blocking treatments long term. There are medications like Femara and tamoxifen which can be used on people with very high risk, but it's again, go see a genetic counselor, discuss the risks, discuss where we stand, what is your risk, and then discuss with the doctor and see what can be done. So prevention is in our hands. How do we prevent it? Lifestyle, eating healthy food, exercise, not drinking alcohol excessively, no smoking at all, doing regular mammograms, breast examination by all of you. Learn self-breast examination once a month, a week after your period. Examine your breast. Use the palm of your hand. Use this part of the hand. Feel the breast, feel your thing all over. If there is any lump, any abnormality, go to the doctor. Once a year, go to your regular doctor. Get the doctor to examine your breast. And be interactive, be aware, and be proactive. With that, I would stop Hema and leave it at that.
Yeah. Thank you so much, Rekha. I'm sure everyone would have taken the important message, what she told about our diet, our lifestyle changes and everything, which is very beneficial to keep our health in a very good shape. So with this, I would like to conclude as well. And if there are any personal questions, I think you should go and speak to your doctor, because this was more a general talk, which would be basically applicable for everyone in general. And if there is anything which you would like to ask, you can just post the messages there. And Rekha, as I told you, she's a very busy person. If she gets time, she will answer. Otherwise, I will pass on that message to her, and we'll make sure your responses will be given on time. Yeah,
I will definitely make an effort to answer if there are any questions.
Yeah.
And good luck to the Sari Gallery, and good luck to Hema.
Thank
You're
you
doing
so
a
much.
fantastic job.
Thank you so much.
Our Indian culture is our sari, and we represent what we are, and Hema is bringing it out as on a platform for all of us to enjoy and interact and chat with one another, every part of the world.
Yeah.
Have a good day for everyone, and let's be aware of breast cancer and let's promote it in the world.
Thank you so much. Thanks, guys. Signing off. Bye-bye.